Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How effective is Atezolizumab Tecentriq? Key points. Atezolizumab, brand name, Tecentriq, is approved to treat several different types of cancer. Its effectiveness and your length of response will depend upon your diagnosis, previous treatments, and other medical conditions, among other factors. Cancer treatment is always individualized for each patient. Your effectiveness and side effects with Tecentriq may not be the same as others who receive this medicine. Your doctor who is managing your cancer treatment regimen will always be the best healthcare professional to answer questions about your medicine, including effectiveness and side effects. Tecentriq, Atezolizumab, from Genentech, is approved by the FDA to treat advanced melanoma, skin cancer, metastatic non-small cell lung cancer, NSCLC, extensive stage small cell lung cancer, SCLC, liver cancer, hepatocellular carcinoma, alveolar soft part sarcoma, a rare soft tissue tumor. Which uses for Tecentriq have been withdrawn in the US. In December 2022, Genentech voluntarily withdrew the FDA accelerated approval for Tecentriq in locally advanced or metastatic urothelial carcinoma, MUC, bladder cancer, in patients who are not eligible for cisplatin-containing chemotherapy. Results from the IMvigor130 study did not meet the endpoint of overall survival, OS, for Tecentriq plus chemotherapy compared with chemotherapy alone. In March 2021, Genentech voluntarily withdrew the US accelerated approval for Tecentriq in prior platinum-treated metastatic urothelial carcinoma, MUC, bladder cancer. Other bladder cancer uses were not affected. Results from study IMvigor211 did not meet its primary endpoint of overall survival in the PD-L1 high patient population. In August 2021, Genentech voluntarily withdrew the US accelerated approval for Tecentriq in combination with albumin-bound paclitaxel for adults with triple-negative breast cancer, mTNBC. This is not related to any changes in either the effectiveness or safety associated with Tecentriq. Related, FDA approval history for Tecentriq. Tecentriq targets the PD-1/PD-L1 pathway, proteins found on the body's immune cells and some cancer cells. By blocking these interactions, Tecentriq may help the body's immune system fight cancer cells by reactivating the T cells. Tecentriq is part of a group of immunotherapy drugs called immune checkpoint inhibitors. These medicines have proven to be effective for many patients with various cancers, often extending a patient's survival time or time without T-air disease worsening. How effective is Tecentriq for cancer? Tecentriq effectiveness for metastatic non-small cell lung cancer, NSCLC. In December 2018, the FDA approved Tecentriq, Atezolizumab, used in combination with Avastin, bevacizumab, paclitaxel and carboplatin, chemotherapy, for the initial treatment of patients with metastatic non-squamous non-small cell lung cancer, NSq NSCLC, with no EGFR or ALK genomic tumor aberrations. In the Phase 3 study known as IMpower 150, Tecentriq plus Avastin, bevacizumab, and chemotherapy helped patients live significantly longer compared to Avastin and chemotherapy, median overall survival of 19.2 versus 14.7 months. Progression-free survival, the risk of disease worsening or death, was a median of 8.5 months for the group receiving Tecentriq plus Avastin, bevacizumab, and chemotherapy, and a median of 7 months compared to Avastin and chemotherapy treatment only. Tecentriq is also approved to treat other patient groups with metastatic NSCLC. Speak with your doctor about further results with Tecentriq in patients with NSCLC. Tecentriq effectiveness for small cell lung cancer. In March 2019, the FDA approved Tecentriq, Atezolizumab, as a first-line agent to treat adults with extensive stage small cell lung cancer, SSCLC. Tecentriq is used in combination with carboplatin and etoposide chemotherapy for this indication. In clinical studies, Tecentriq was evaluated in 403 adults who had received no prior chemotherapy. Median overall survival for those who took the Tecentriq combination was 12.3 months, compared to 10.3 months among those who took the chemotherapy drugs and a placebo. The Tecentriq-based combination also significantly reduced the risk of disease worsening or death compared to chemotherapy alone, 5.2 compared to 4.3 months. Tecentriq effectiveness for advanced skin cancer, melanoma. In July 2020, Tecentriq, atezolizumab, was approved to be used in combination with Cotellic, cobimetinib, and Zelboraf, vemurafenib, for the treatment of patients with BRAF V 600 mutation-positive unresectable or metastatic melanoma. A BRAF gene mutation is found in some types of cancer, including melanoma. This mutation can increase the growth and spread of cancer cells. In the Phase 3 clinical study IMpower 150, the addition of Tecentriq to Cotellic and Zelboraf helped people live longer without their disease worsening or death, progression-free survival, PFS, compared to a placebo, inactive treatment, plus Cotellic and Zelboraf. The median progression-free survival, the primary endpoint of the study, was 15.1 months in the group receiving Tecentriq plus Cotellic and Zelboraf. In the group receiving placebo plus Cotellic and Zelboraf, the PFS was 10.6 months, a statistically significant difference, c. 0.63 to 0.97, p equals 0.025. Related questions: are there cost-saving programs for Tecentriq? Is atezolizumab, Tecentriq, a chemotherapy or immunotherapy drug? Does atezolizumab, Tecentriq, cause hair loss? Tecentriq effectiveness for liver cancer, hepatocellular carcinoma. In May 2020, Tecentriq was approved to be used in combination with bevacizumab, Avastin, for the treatment of patients with liver cancer, hepatocellular carcinoma, that cannot be removed surgically or that has spread in the body. In addition, these patients have not received treatment for their liver cancer. This regimen has been shown to improve a patient's survival over sorafenib, Nexavar, the standard of care for first-line hepatocellular carcinoma. Approval was based on the results of the Phase 3 IMbrave 150 study. The study showed that Tecentriq in combination with Avastin significantly reduced the risk of death, known as overall survival, a primary endpoint, by 42%, hazard ratio, HR equals 0.58, 95% C, 0.42 to 0.79, P equals 0.0006, compared to sorafenib, Nexavar. Tecentriq plus Avastin also significantly reduced the progression-free survival, PFS, which is the risk of disease worsening or death, by 41%, HR equals 0.59, 95% C, 0.47 to 0.76, P less than 0.0001, compared with sorafenib. The median progression-free survival was 6.8 months for Tecentriq plus Avastin compared to 4.3 months with sorafenib, Nexavar. Tecentriq effectiveness for alveolar soft part sarcoma, ASPS. In December 2022, the FDA approved Tecentriq, atezolizumab, for the treatment of adult and pediatric patients 2 years of age and older with unresectable or metastatic alveolar soft part sarcoma, ASPS. Approval for this use involved a Phase 2 single-arm study in 49 patients with ASPS that could not be removed by surgery, unresectable, or had spread throughout the body, metastatic. Results showed that treatment with Tecentriq produced an overall response rate, ORR, of 24%. Of the 12 patients who achieved an objective response, 67% had a duration of response, DOR, of 6 months or longer, and 42% had a DOR of 12 months or longer. The most frequent serious side effects in at least 2% of patients were fatigue, pain in extremity, pulmonary hemorrhage, bleeding in lungs, and pneumonia, 4.1% each. Side effects can be serious and numerous with many cancer treatments, including Tecentriq, atezolizumab. Although Tecentriq is an immunotherapy and may be associated with less side effects than traditional chemotherapy, effects on normal cells can still occur. See a full listing of Tecentriq's serious and common side effects here. You should speak with your doctor about the side effects that may occur with any of the cancer treatments you receive, including Tecentriq. Bottom line. Atezolizumab Tecentriq is approved to treat several different types of cancer, including melanoma, liver cancer and lung cancer. Tecentriq is an immunotherapy drug called an immune checkpoint inhibitor and helps the body's immune system fight cancer cells by reactivating the T cells, a type of white blood cell. Cancer treatment is always individualized for each patient. Its effectiveness and your length of response will depend upon your diagnosis, previous treatments, and other medical conditions, among other factors. Your doctor who is managing your cancer treatment regimen will always be the best healthcare professional to answer questions about your medicine, including effectiveness and side effects. This is not all the information you need to know about Atezolizumab Tecentriq, effectiveness for its various uses, or for its safe and effective use. Review the full Tecentriq information here, and discuss this information with your doctor or other healthcare provider. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.